Welcome to our educational video on entropion and ectropion, two common conditions affecting the eyelids. Join us as we explore the causes, symptoms, diagnosis, and treatment options for these conditions, helping you understand how they impact vision and overall eye health. Let's start with the causes. Entropion, the inward turning of the eyelid, is often caused by age-related muscle weakening, known as involutional entropion. Scarring from previous infections or surgeries can also lead to cicatricial entropion. Less commonly, congenital entropion, present at birth, or spastic entropion, caused by eyelid muscle spasms, can occur. Ectropion, the outward turning of the eyelid, also has several causes. Involutional ectropion, similar to entropion, is common with aging. Paralytic ectropion results from nerve damage, often affecting the facial nerve. Cicatricial ectropion stems from scarring, burns, or skin conditions pulling the eyelid outward. Mechanical ectropion can be caused by tumors or growths on the eyelid. Now let's delve into the pathophysiology. In entropion, the inward turning of the eyelid causes the eyelashes to rub against the cornea, the clear front surface of the eye. This constant irritation can lead to corneal abrasions, ulcers, and even scarring, affecting vision. In ectropion, the outward turning of the eyelid disrupts the normal tear drainage. This exposes the inner surface of the eyelid and the cornea, leading to dryness, irritation, and increased risk of infection. The inability to properly spread tears also contributes to corneal damage. Entropion and ectropion are primarily age-related conditions, meaning they are more frequently observed in older adults. However, the prevalence rates can vary based on geographic location and ethnicity. For example, conditions causing scarring, such as trachoma, might increase the prevalence of cicatricial entropion in certain regions. Paralytic ectropion's epidemiology is linked to the incidence of facial nerve palsies. While these conditions are generally not life-threatening, they can significantly impact quality of life and vision if left untreated. The signs and symptoms of entropion and ectropion can be quite noticeable. With entropion, you might experience a feeling of something in your eye, excessive tearing, redness, pain, light sensitivity, and decreased vision. The constant rubbing of eyelashes against the cornea is a key indicator. For ectropion, symptoms include excessive tearing, chronic eye irritation, dryness, burning sensation, redness, and sensitivity to light and wind. The outward turning of the eyelid is visually apparent, exposing the inner eyelid lining. Diagnosis of entropion and ectropion is typically straightforward and based on a thorough eye examination. The doctor will assess the position of the eyelids, the condition of the cornea, and the function of the eyelid muscles. A slit lamp examination, which uses a high-intensity light source, may be performed to closely examine the cornea for any damage. In cases of paralytic ectropion, neurological examination might be necessary to assess the facial nerve function. While there aren't formal classifications of entropion and ectropion beyond their causal categories, understanding these types helps tailor treatment. For entropion, we distinguish between involutional, cicatricial, congenital, and spastic types. Similarly, ectropion is categorized as involutional, paralytic, cicatricial, and mechanical. Recognizing the underlying cause is crucial for effective management. Treatment for both entropion and ectropion aims to alleviate symptoms and protect the cornea. For entropion, temporary relief can be achieved with lubricating eye drops and ointments. A bandage contact lens can protect the cornea from eyelash abrasion. Definitive treatment usually involves surgery to reposition the eyelid. Different surgical techniques exist, depending on the type and severity of the entropion. For ectropion, similar conservative measures like lubricating drops and ointments are used to manage dryness and irritation. Surgical correction is often necessary to tighten the eyelid and restore its normal position. The specific surgical approach depends on the underlying cause of the ectropion, such as repairing tendon laxity in involutional cases or addressing nerve damage in paralytic cases. While it's difficult to completely prevent age-related entropion and ectropion, there are steps you can take to minimize your risk or the severity of the conditions. Protecting your eyes from sun and wind can reduce irritation. Prompt treatment of eye infections and inflammatory conditions can help prevent scarring that might lead to cicatricial entropion or ectropion. Regular eye exams are crucial for early detection and management. The prognosis for entropion and ectropion is generally good with appropriate treatment. Surgery is often successful in restoring the normal eyelid position and alleviating symptoms. However, recurrence is possible, particularly in cases of significant tissue laxity or nerve damage. Ongoing research is focused on developing less invasive surgical techniques and improving our understanding of the underlying causes of these conditions, potentially leading to more effective prevention strategies in the future. For example, research into targeted therapies for facial nerve regeneration could improve outcomes for paralytic ectropion. Thank you for watching.